Okay, so with our patient, we're going to begin with an active warm-up. We're going to have them on the recumbent stepper for 5 to 10 minutes, maintaining a light to moderate RPE score. And being in that recumbent position will allow them to start activating those leg muscles while being in a comfortable seated position, which being in that recumbent position should decrease the stress in their lumbar spine. And with this active warm-up, it'll increase the amount of metabolic heat being produced in the leg muscles, which will increase the pliability of the muscles and allow us to effectively perform the interventions that Adam will take us into.
Perfect. So thank you. So the first impairment we'll be addressing is the tight superficial fascia in the lumbar spine. We will be targeting this with tissue rolling. This technique will produce a mechanical alteration of the adhesions, causing restriction in the superficial fascia. The next impairment we will be addressing is the hypertonicity of the erector spinae muscle due to the lower cross syndrome. We will be treating this with the erector spinae muscle play. This technique causes short-term neurophysiological effects by stimulating the Ruffini organs and the interstitial myofascial receptors. These stimulate the autonomic nervous system, which will produce changes in tone, vasodilation, and local fluid dynamics. The last impairment I'll be talking about is the tight bilateral hamstrings. We'll be addressing this with the myofascial manipulation of the hamstrings. This technique will stimulate the type 3 mechanoreceptors, which will cause muscle inhibition and prepare the tissue for elongation later in the treatment. After the completion of these myofascial techniques, a reassessment will be done to see if the impairments still remain. If it is still noted that there is hypomobility at the facet joints in the lumbar spine between L2 and L4, we will perform grade 3 and 4 joint manipulations. These manipulations will decrease collagen crosslinks, improve tissue crimp, promote fiber glide, and increase ground substance, which will all improve range of motion.
So once we finish those interventions, we're going to begin some joint and myofascial elongation. And we're going to target the tight hip flexors and the tight hamstrings. And for both impairments, we're going to use the PNF to contract, relax stretching technique. And by using the contract, relax technique, we can inhibit the GTOs in those tight muscles. And once those GTOs are inhibited, we can take the muscles into a further range and put greater tension on them, allowing for a greater stretch over a more sustained period of time. And following the PNF stretching, we're going to reassess, taking goniometric measurements of hip extension to assess if we've altered the hip flexor length, as well as straight leg raise, take a goniometric measurement of that to see if we've increased our range there, which would tell us if we've altered the length of the hamstrings.
Following that reassessment, we're going to move on to some neuromuscular reeducation. We're going to start off by focusing on the abdominal corset. This will help us with a few things because during our evaluation, we found that our patient had weak abdominals and a hypermobile L5-S1 segment in their lumbar spine. Strengthening the abdominal corset could consist of some multifidus isometric contractions for 10 repetitions of 10 seconds, followed by some quadruped toe slides, keeping that pelvis nice and level, and that can be progressed to quadruped toe slides, quadruped shoulder flexion, quadruped hip extension. Once she gets that dynamic control over low back and pelvis down, we're going to go on to a hip flexion, knee extension exercise on a ball, which will help increase this patient's endurance, which will then translate to the patient's posture throughout the workday. Another aspect that we found was weak on our patient during our evaluation was her glutes. So we're going to start by reinforcing the abdominal bracing with a posterior pelvic tilt, and then work on glute bridges with that posterior pelvic tilt for 3 sets of 10 repetitions. to increase her strength, along with some body weight Romanian deadlifts for 3 sets of 8 repetitions with a slow eccentric phase, really targeting those glutes with that. And we'll also be doing squats for 3 sets of 8 repetitions because this will help our patient functionally throughout her workday. After we complete these interventions, whether it's during one session or over multiple sessions, we're going to be constantly reassessing our patient's response and monitoring if she's getting stronger throughout these sessions. So then after that, we're going to go into some postural instruction. Our patient mentioned she works 10 hours a week at her desk. We want her to bring in a picture of her desk so we can modify it so that she will have good posture during her workday. And then we also want to take a look at how she's transferring patients in and out of bed and helping with their bed mobility and things like that on the job, because we really want to look at her body mechanics to make sure she's utilizing her legs and not compromising her back throughout the entire process. For her home exercise program, we're going to really focus on that posture, making sure she maintains some body awareness along with some glute bridges with the posterior pelvic tilt, really driving home that abdominal bracing and strengthening those glutes. And then we're also going to pair that with some hamstring stretching down the line, which will help our patient just overall.
All right. That is it for our case 1 presentation. Thank you.